TearLab diagnostic test offers an objective, quantitative test for diagnosing and managing the ocular surface. The TearLab test requires only 50 nanoliters of tear film and provides a quantitative assessment of tear film health in less than 30 seconds. The test is fast, easy, and accurate, and can be performed by both doctors and technicians. After explaining the procedure to the patient, you are now ready for patient testing. Be sure the patient has not used therapeutic drops in the past 2 hours to avoid a false osmolarity reading. If therapeutic eye drops have been used within 2 hours, testing should be delayed to another time. Testing is allowed 15 minutes after dilating or anesthetic drops are administered. Remove a test card from the pouch and note the numeric code on top of the card. Remove a pin from the TearLab. Hold the wings of the test card and insert the test card onto the pin. Ensure that the wings of the test card are snapped tight to the pin. A green light will illuminate and a beep will sound, indicating that the test is ready to be performed. You have 2 minutes to perform the test. Securing the wings of the test card with one hand, pull up with the other hand to remove the protective cover. Approach the patient from the side. Position the patient with their chin tilted upward and their eyes directed toward the ceiling and away from you. Remind the patient to blink normally. It's okay to place a hand on the cheek to stabilize the pen, but do not pull down on the lower lid, as the tear lake will disappear, making tear collection difficult. Position the pen beyond the eyelashes near the corner of the eye. Tears are collected on the bottom of the tip of the test card. Lower the pen until the bottom of the tip touches the line of moisture on top of the eyelid. The tip should actually come in contact with and touch the top of the eyelid, but avoid touching the white of the eye. Successful tear collection will be indicated by the beep of the pen and the green light going off. Dock the pen into the TearLab within 40 seconds and note the numeric code on top of the test card. Enter the numeric code by pressing the recall buttons below the up and down arrow keys on the TearLab. You have 8 seconds to match the codes. Press OK to accept the code. Wait for the result and record the result in the patient chart. Repeat the procedure on the other eye with a new test card. If tears are not collected immediately, do not pull the pen away from the eye. Leaving the test card in contact with the eyelid, lightly brush the pen back and forth along the outer 1/3 of the lid, avoiding the cornea. Now that you have recorded the patient's test results, you are ready to discuss the results with your patient. You have seen and experienced how easy it is to use TearLab. If you have additional questions, please call customer care